really bad start already. My name is Seth Himker, doing my head-to-toe assessments for the class here. I just watched the patient walk into the room. He had normal range of rhythm, range of motion in his hips and legs, steady gait, and no deformities noticed upon walking. Good afternoon. How are you today?
I'm doing good, sir.
You know what you're here for?
An assessment of some sort.
Can you tell me your full name, please?
Jimmy John,
All right. Do you know what year it is?
2017.
You know who the president is?
Donald Trump.
All right. So patient is alert and oriented ×3. So first thing I'm going to do is just assess your sinuses. Tell me if there's any pain, any pressure.
No pain, no pressure.
All right. Assess your TJ joint here. If you open and close your mouth, please. All right. No pain.
No pain.
No crepitus felt here. Any head injuries? Have you fallen in the past here recently?
No, sir.
All right. So everything in the head looks symmetrical. No pain, no nodules felt. Lymph nodes, no swelling in them at all. Looking at the veins, can you push up on your shoulders? All right. Can you stop me from pushing down? There you go. Can you look to your left, please? All right. On the other side. All right. Normal strength in the patient here. Can you close your eyes? And you don't let me open them. All right. Say it with your mouth. Don't let me open. All right. Open your mouth. Don't let me close it. All right. Can you stick your tongue out? Can you frown? All right. Can you raise both eyebrows? All right. I'm going to take a look here. Angelique, I'm going to shine a light into your eye here. Just look straight at me. So you're checking for the light to see do both pupils react to the light, which they do. Now I want you to stay right here. And can you look into your nose? Can you look out? Can you look up and down and to your left, to your right? Very good. Can you cover your left eye? Can you read this?
Yes, I can.
Can you cover your other eye? Can you read this?
Yes, I can.
Okay, cover both eyes, please. Don't cover both eyes. Uncover both eyes. Can you read this?
Yes, I can.
Very good. What I'm going to do here is have you close your eyes. I'm going to touch you with a Q-tip, all right? I just want you to tell me where I'm touching you.
Okay. My chin, my left cheek, my right temple.
All right, so the patient has normal senses. Next thing I'm going to have you do here is I'm going to take a look inside your mouth to see how everything is. Say ah.
Ah.
So mucosa is pink, moist. There's no signs of any deformities. I'm going to check a gag reflex.
Ah.
All right, normal gag reflex for the patient. What I have to do is look directly at my nose. Can you tell me how many fingers I'm holding up?
2.
How about here?
3.
How about here?
3.
How about here?
1.
All right. Next thing here that we're going to do is take a look into his ears. So on an adult, you take the goat and you pull up and back. You can look at the ear canal, looking for any signs of deformities, any blockage, anything on the eardrum itself. On a child, you would pull down and out. All right. Alright, so everything appears to be within normal limits in the ears. There's no blockage. There's no issue to the eardrums. I'm going to administer a whisper test. Just repeat after me what I say.
So, we.
All right, patient is able to hear everything on the whisper test. Next, I'm going to check the eye. I'm checking for the red lens reflect here. Okay, so at the normal limits. The next step here that I'm going to do is take a listen to the patient. So what I'm listening for here is the lung sounds. Is there any wheezing? Take a deep breath in and out. Every time I move my stethoscope, if you take a deep breath in and out. Right, there's no signs of any breathing difficulties. The chest is rising symmetrically. I'm going to listen to the back now. Same thing, every time I move my stethoscope, just take a deep breath in and out, please.
Okay.
Very good. Same on the back. We're not hearing any abnormal sounds. Can take a deep breath for me in and out, please. And we are having proper symmetrical expansion of the back as well and the rib cage. On the chest, do you feel any pain, pressure when I'm pushing?
No pain, no pressure.
Anything on the back?
No, sir.
Alright. I'm going to do percuss here. What you're listening for here is any sounds. Dull sound is got a, meaning you're over a muscle, it'd be over an organ. If you hear the sound, it means there could be some air underneath there. Next step that we're going to do is take a listen to your heart. First part we're going to listen to is the aorta up here, and then we're going to the pulmonic, Erb's point, the tricuspid, and the mitral. So where you hear the S1 and then the S2 sounds, the lub dub. So here you just breathe normal. Alright, everything sounds within limits. I heard the S1 and the S2. You check into the system here, feeling their pulses. They are symmetrical bilaterally. And I have to go ahead and squeeze my fingers. Right. Patient is able to have bilateral strength in it. Can you raise your legs up against me? Okay, and then down. Patient has appropriate strength in both lower extremities. Can you take your arms and raise them out to your side? And then don't let me raise them down. Patient also has, push your arms down, appropriate strength to his upper extremities as well. The next step that we would do would be taking a look at the patient's chest area into the breast. We'd want to see nipple line at midline. Look for any deformities we would see during the feeling part here, the palpation. If there's any lumps, bumps, that's things that we want to look for. Next here, I'll have you lay down, please. So first part here that we look is we would be inspecting the patient's abdomen. So the same thing, looking for any discolorations. Patient here has no discolorations to the stomach, no visible bulges or anything like that. Next we're going to do is take a listen to the 4 different quadrants here in the abdomen. the patient has some hyperactive bowel sounds in there. You can hear the air passing through as well, so no issues there with him. Now is when we would percuss. I just want to feel. Does that hurt? So what you're looking for, any pain, any reverberation pain across the stomach when you push. If you can feel the liver, I'm going to do a percussion. Just tell me if it hurts. Nothing there. So the patient is symmetrical, said no reverberating pain, hypoactive bowel sounds, and that includes all of your stomach, the intestines, everything that you're looking at for them here. The next step that you would look down for the patient would be into the genitalias, which we will not be showing the patient. You'd be looking for the same on a male patient here, any bulges, as symmetrical as everything could be. They could cough to see if there's any hernias coming through. Alright, so see that concludes our head to toe assessment. We did the head and neck, the HENT up here, which was the throat, the ears, the nose, and the eyes. We tested the muscular system involved in has he have the right proper strength, which he has the proper range of motion, appropriate strength. We checked the chest, which is the heart and lungs. Listening to them there. And at the veins here, the thing you can do is have the patient, can you look to your left, please? Your whole head. And then I'm going to pull your head here real quick. I'm going to remove the pillow. Next thing, can you just take your head and lift it straight up towards your chest? So you're looking for JVD or jugular vein distension. You can put your head back down, which he has none. That is also what we would need to look for. The trachea is midline to the neck. We then discussed the abdomen with his intestines and his stomach. Everything was in normal range. Then we took the overall strength.